thank you for this opportunity, because I really do enjoy talking about this topic. Today the general aims will be introducing everybody to what is a qualitative evidence synthesis and some basic principles on search methods, setting criteria, screening, extracting data and synthesizing the findings, and then using the application of grade CERQUAL to the findings of the QES. And that last one is probably the one that is the most challenging part of undertaking a QES. But from experience, if you want to get published, you really have to go to that final level. Now, currently with our master's students in Galway, at NUI Galway, we don't expect students to do a CERQUAL on their findings. Some of them do, obviously, but it's not an expectation, because it is a big extra piece of work and requires a bit of experience. I'll come back to that again in a few moments. So when we look at qualitative evidence synthesis, we first of all have to think about, well, what is qualitative and what is qualitative data? And there are a variety of qualitative methodologies where the data can be extracted for a qualitative evidence synthesis. And you can see them there. And from my experience of undertaking and being involved in different syntheses, most of the studies tend to be just qualitative, descriptive. You will get some grounded theory, very few phenomenology, very few ethnography, and very few case studies. So they tend to be qualitative, descriptive, or mixed methods. And there is a challenge, as you can see on the right-hand side there. Observation is data, but it is difficult to actually use that data and how to use that data in a QES. So I suppose you're using the researcher's interpretation of the observation. Now, I'm going a bit deep there, but it's not always straightforward, but this is all considered data. So I have a reference there at the side, Fleming, and there are some people, if you want to find out about qualitative evidence synthesis, there are a few authors that if you just search their names, you'll find everything you need. And the second name there, I can't see through the camera, but it's Andrew Booth, and he is a real guru on this, and he came and did a workshop in Galway, it must be about 18 months ago, and just wonderful. He explains things so simply, and he's able to unpack a complicated issue. And I know I really enjoyed the workshop and came away really understanding this in a deeper way. And Jane Noyes as well, you see her name there. She's also another name to watch out for. So this is their paper here, and they talk about it being a broad term for a group of methods used to undertake systematic reviews of qualitative research evidence. And if you look at the history on this, this is relatively recent enough methodology, and there's been an explosion in the last couple of years. And interest in this whole area of synthesizing qualitative research was spurned, I suppose, in 1988 with that publication by Noblet and Hare, and they called it meta-ethnography. And I went to a talk from a researcher, an English researcher, about 9 years ago, and I remember listening to what she was saying about this meta-ethnography, and I thought, oh, I'd love to be able to do that. And but what I'm doing now is different. Meta-ethnography is a type of evidence synthesis of qualitative work, but it's slightly different, and it is more challenging to do than the version that I'm going to talk about today. But just to show you, there was quite a time span before researchers picked up this text and then undertook a synthesis of qualitative research and called it a meta-ethnography. And then in 2013, this is a great milestone, Cochrane published its first qualitative evidence synthesis. And as you know, Cochrane are gold standard, and when they start to publish QES, that's really good because they have brilliant guidelines, and we've tended to use their guidelines in NUI Galway. We follow any expert sort of, I suppose, opinion. The authors involved in QES in a QES with Cochrane tend to be the same experts, and they have developed very robust approaches to undertaking a QES. And I was lucky enough to be involved in a Cochrane QES with Catherine Houghton and others over the last couple of years, and it's finally got published there recently. And that was a huge learning curve in terms of how to undertake a QES using the Cochrane guidance. So there are a whole lot of terms out there, and when you're looking in the literature, the potential to be confused is great, because all of these terms are used, and there's probably even more that I amn't aware of. But today, I'm really going to just focus on the qualitative evidence synthesis, the Thomas and Hardin approach. There is also a framework approach, and I'll mention there's this framework synthesis, and I'll actually talk a little bit about that too, because that's quite popular. But just want to go down here. These are some new emerging terms that you'll see: this mega ethnography and the rapid QES. And it just shows how things are always evolving. This group here have published some work on a mega ethnography, and mega meaning using already published qualitative evidence synthesis and pulling them together into another type of evidence synthesis. And this is very like the umbrella review that you'll see used with a systematic review. So this is a fairly recent, I suppose, development, and I haven't seen much of it yet, but I anticipate with so many qualitative evidence synthesis being published, this is going to take off. And over here, I need to mention this, I suppose, another development called a rapid qualitative evidence synthesis. And this has emerged from the need for rapid guidelines. Policymakers are looking for this. And this is a lovely paper led by my colleagues, Linda Beastie and Catherine Houghton were involved in this as well. And they undertook a rapid evidence synthesis, a qualitative evidence synthesis, this one here, in March of this year, in response to a need for guidance on barriers and facilitators to healthcare workers' adherence with infection protection, prevention and control. And this was published in April, and already I just checked it up today, there's been 71 citations on in Scopus for this piece of work. So huge interest, and you'll really be interested if you read the background paper on this. They did the search, the screening, the data extraction, the synthesis, I think in a matter of about 3 weeks. So literally, that's why it's rapid, but you have to take some corners when it's rapid. Obviously, you don't search all the databases or a number of databases. They only searched one database, but it's worth your while to have a look at that, because it's very interesting, this whole area of rapid qualitative evidence synthesis. So which one do you use? You can see in that earlier slide, there's lots of versions of evidence synthesis, and which is the one to use? Well, there's we're back to Andrew Booth again, and he has published the retreat framework. There were some earlier ones, but this one is really helpful. And using these domains, you make a decision on what is the most appropriate approach to your qualitative evidence synthesis. So for instance, going back to the previous example with the rapid QES, they needed to come up with a finding very quickly. So the time frame was a major factor there. So it was the most suitable one to do. It depends again. Looking at the type of data, some data isn't very rich, and some data it can be quite thin, and some can be very rich. And again, do you have any financial support to undertake it? And can you hire, let's say, an information specialist to help with the search and developing the search? So this retreat framework is very useful to help you decide which type of qualitative evidence synthesis you should use. So now going to the 10 steps. I like things in numbers. I find it easier to follow if I have like 10 or 9 or 8. I find that much easier for me to kind of get a big picture. I learn better if I have a big picture, and then when I see the whole, I can go back into more detail. I prefer to see how something works from beginning to end, and then I'll go back and I'll find out the more detailed aspects. So the first thing I would advise anyone who wants to do a qualitative evidence synthesis is to do a scoping search. And by that, find out what's out there on your topic, and that will help you define and refine your review question. And that's really important. And I've made some mistakes in this area. I'll give you an example. With the student did the scoping search, and I asked the student, well, did you find anything? The student said, yes, I did find there is qualitative work out there. So yeah, it will be good. I didn't find anybody else, any other QES published. That's great. So we progress, the search is done, then we start screening the studies and find out there are far too many. It turned out that there was a huge amount of research on this, but the student would have been, well, my fault. I should have asked the student, how much did you find, and were there particular areas, because the question then was too broad, and we ended up with a bit of a problem, but we were able to solve it later. But just to give you an example of taking your time, do the scoping search, see what's out there, and refine that question. If there's a lot, you might need to look at one particular area of the topic that you originally thought that you would, or your research question. You really have to write a protocol. You cannot not do this without writing a protocol. And this is like your menu. So what menu do you follow? Well, the reporting guidelines are these reporting guidelines, the NTREC. And if you go into the website, you'll see that there are all the other reporting guidelines here too. But this is the one to follow. And if you look at this here, these are the items that should be included in a qualitative evidence synthesis. So when you're doing a protocol, you can go so far, of course, you go as far as before coding, but even though you can mention how you're going to actually do your analysis and do your synthesis. So this is a really good guide for a protocol, and everybody should do this before they move to do the actual QES, or you could end up in awful trouble if you don't. You could end up going down places that you shouldn't go, or didn't need to go. Now, I want to tell you about the Cochrane group. This is the Epoch, and this group have a template, and it's, if you can Google it and you'll find it. And this is really good. This goes further than the previous guidelines, the NTREC. The Epoch actually has a section where they describe how you would write your protocol, and there's great guidance in it. And the Epoch, it is very like what I've just told you here, but it just gives a bit more guidance, and excellent for anybody who wants to write their protocol. And the template is so easy to follow. It literally tells you what you need to write and what areas you need to mention. And it gives very good guidance. And it also includes reflexivity. And that's very important, because researcher reflexivity is an aspect of a QES. Is there anything about the researcher researchers undertaking the QES that is important to know and might have influenced maybe data extraction or synthesis? So that's those guidelines. Next, you've got to define your question. So you know the area, you have a question. So everybody knows about PICO, spider, SPICE, and so with the qualitative evidence synthesis, we'd use a small O. There isn't any outcome. I find I have to play around a bit. I might have a question and it fits better in a PICO, and then another question I might fit better with a spider. So I do play around and find out which one does it fit best for. So there's a bit of playing around there with that. And this is a SPICE that we used for this study here that was published last year on healthcare professionals' experiences and views of palliative care for patients with a hematological malignancy. So this was very helpful, and it fitted well with a SPICE. So we found this was the most suitable for this. So after that, you need to plan your eligibility criteria. Now, sometimes this is a bit of a chicken and egg thing. You kind of have to go back and forth a bit on these steps here. You go forward and you go back, and just make sure before you do your search that you also have your inclusion and exclusion criteria very tight. But there's a bit of back and forth with this. It's not linear. At some points, you need to, you know, check across. So this is interesting now. This is what seems to be more recent, in that because Google Translate is very sophisticated, or more sophisticated than it used to be. This is for some recent QESs that I have seen. They are including any language that can be translated by Google. You will see a lot of qualitative evidence synthesis that exclude any study that's not in English. But if you can at all, and if you have the time, it is useful to translate. I did it for one QES. There was a French study and there was a German study, and it turned out when we did get it translated, the German study turned out to already have been published in English in another one of the studies that we found. So yeah, but it is good if you can include other languages. Any publication, the publication type is normally a primary research study, qualitative, and also unpublished theses. You can find very interesting literature in unpublished theses, like recent PhD thesis, and it's really important to keep an eye on that. We published a QES 2 years ago, and we found an unpublished thesis through a Twitter feed that was sent to me because this other person knew that I was interested in the topic. We contacted the researcher. It was their PhD, and it wasn't released yet. So we waited about 2 months, and then we integrated it to the data, and it was really helpful to our study. So obviously you exclude secondary research opinion pieces and commentaries. And the methodologies, any qualitative design, including mixed methods with qualitative findings. So planning the search strategy. Right, if you're a master's student, it's difficult to get the help of a librarian, but obviously if it's a funded study, or if it's a study that you're doing as part of your work, it is always advisable to enlist the help of an information specialist, and of course include them then as one of your authors. This is the search terms that we used for that QES on healthcare professionals' views and experiences of palliative care for patients with a hematological malignancy. And there's a lot in there, as you can see, and particularly when you include all of the different terms used for blood cancers, there's a huge amount there. And that's where it's always good to have someone on your team who knows the area. Obviously, if it's a clinical topic, you need an expert on the team who knows, like, are these terms the terms that would be used? Because sometimes you can come up with terms that are never used and wouldn't be used, and so they can be excluded. And this is like this. These are the terms that we use for the qualitative string. We've had help over a number of years to refine this. So obviously qualitative mixed methods, interview, observation, focus groups isn't enough. You really have to go and include a lot more terms like that. And this seems to have worked for us. And we also include questionnaire in there because you can get some qualitative data from open questionnaire type studies. Unusual, but it's better to go wide enough to try and find that just in case. Now, I want to introduce you to another guideline. There are a lot of guidelines that can be used, and this is the Press Peer Review of Electronic Search Strategies. And this is used for quality initiative if you really want to go to the next level. And this is where the search strategy that was used and is checked with another information specialist using these this guideline here. You need, of course, I was lucky with that other QES I just mentioned. The librarian that helped us, Mike Small in Galway, he was able to get in touch with a librarian in Limerick who did a check on the search that was used. So that was really good, and it is like a good quality check on your search. Okay, we use a lot of software to help us with the qualitative evidence synthesis, and using it smartly is important. So obviously, EndNote or any other kind of reference storing software is used. So when you do the search, you save it onto, this EndNote is the one I use, and then you remove all the duplicates. And of course, you've got to keep your record very carefully for your Prisma when you give your when you report your studies, how many you found, and how many duplicates, and that. And then you upload your file to a software screening tool. Now there are many of them, and in Galway our students, and I'm using it now with my PhD students, would be the Rayon tool, because it's free. It's a bit more clunkier than Confidence, but you'll be interested to see that a recent paper, the references here, you can't see it here, but it's Harris et al. 2000. They did an analysis of all of the different software tools used for screening. And I didn't realize there were so many. I'd heard of Epi Reviewer, and I'd heard of a few of the others, but I had never realized there were so many. And Rayon and Confidence came out the top, and equally. So that's good. But Confidence is the screening tool used by Cochrane, and Rayon then, as I said, is free. So we get our students to use Rayon. It is a bit clunky. It isn't as sophisticated looking as Confidence, and Rayon doesn't do as much. You can't store your full text in it like you can with Confidence, but it's okay. It's functional. So you have your studies. They're in your software tool. So now you start your screening, and this is really important. So you've got to decide what studies are in, what studies are out, and the maybes are there too, because sometimes it is difficult. You're not sure. So if you're not sure, you always go for a maybe. Now, this is what Rayon looks like, and it's very good. You'll have an output here of how many studies have been included, excluded, and you'll have what types of studies. So it's really lovely, and it keeps a lovely record for you. And the blind was on. That's really important. You turn the blind on so that you can't see what the other reviewer is including or excluding, and they can't see yours. And then you turn it off then, obviously, when you have to discuss conflicts and sort out those issues. But some screening tips: always pilot screen a sample first. Don't go straight into the screening without piloting maybe 10, maybe 20. Now, I do know that in Cochrane, and for some systematic reviews in Cochrane, a lot of people would single screen and then get somebody to screen 20% to see, were they the same ones they would include. I always like to see that there's a double screen, and particularly, well, in any case, even with master students, we encourage our master students to get another person to screen with them, and preferably somebody who has a master's and has a good understanding of methodology, so they'd be able to recognize the qualitative methodology by the abstract. So pilot screen first, and using the eligibility criteria. And that's really important, because I've learned by my mistakes by not doing that years ago, and ending up having to do the whole thing again, because we were on different wavelengths, myself and the screener. She thought that something was to be included, and I didn't put it clearly in the eligibility criteria. That was my fault. Again, sometimes you learn a lot by your mistakes, and it can be a positive experience if you learn and don't repeat the mistake again. So 2 reviewers to review the title and abstract, and then a third reviewer is brought in to resolve any conflicts. And that's important, because sometimes it's very difficult for the 2 reviewers to make a decision. So I tend to do that with my students. So if I have a master's student, they screen with maybe a colleague who has a master's, and then I'll come in and I'll resolve any conflicts. And then the full text screening and 2 reviewers. I tend to screen, I don't know if any of you are supervising master students, but I would always screen with the master student to make sure that we get the right studies, because I have again made the mistake in the past of the student would screen and be happy enough, and then when it comes then to data extraction and synthesis, you realize that there was perhaps a study in there that should never have been included, and it messes things up. So just a tip if any of you are supervising students doing this. So you need obviously to report your search, your removal of duplicates, and your screening in a Prisma. And obviously anything that's excluded at full text, you must give a reason. And this is another issue that can arise when you're excluding a full text and you want to give a reason. There could be 4 different reasons why you're excluding a study. So you need to agree with your screener, a hierarchy. So you'll exclude by, firstly, maybe wrong methodology, next wrong focus. So make that agreement. Otherwise, they'll exclude it for one reason. You'll exclude it for another. And that's not going to help at all when you come to your recording of your Prisma. So to agree all that as you go along is really important. So lots of little meetings as you go along when you're doing a QES. So some challenges that I've faced, finding full text. So ResearchGate is very good, but you'd be amazed the amount of people who don't actually reply when you send them a request. Interlibrary loans is very good, but not all students can actually get access to interlibrary loan. It can cost. So I've emailed authors. Even at one stage I sent a letter to a nurse working in America who had no email address, but I found on Google where she worked on the street, sent her a letter and asked her to email me, which she did. And then we had a conversation. It turned out she had no data to give me. But so you go to whatever lengths you can if you have the time to find those full texts. What if there's too many studies? This is another issue. So you have too many studies to be included in your QES, and they've all met your inclusion criteria. Too many is not good because you won't be able to synthesize it to the depth that you want to with the qualitative evidence synthesis. So you can do what's called purposive sampling. And there's excellent guidance on this now, recently published by Ames, Heather Ames, and it was only, I think, 2 years ago, 2019. And just to give you some background, there was another criteria that was loosely used before this called the CART criteria, but and we had used it on the Cochrane review that got published, but that was preceding this one, and this is definitely a brilliant guidance. So you could purposefully sample based on the richness of the studies, by looking at lower and middle income countries and the relevance of the studies to the question. And well worth for any of you to read that paper. It's really good. They give a worked example of how they did this. So I'll have to use this now in the next couple of months because I'm involved in a QES where there are too many studies. So we're going to use this. So next step is data extraction. So obviously, when you're extracting data, you will use tables to describe the studies. What I tend to do is so I have my studies. So I start with the data extraction. So I extract all the data on a table like this, and then I do my quality assessment of each study. I do all that first before I start doing the analysis and then working up to the synthesis, because it kind of gets you into the zone of looking at the paper and reading the paper. So that's a very simple type of table. This is actually recently published. It's only published a few weeks ago, and this was a qualitative evidence synthesis of palliative care nurses' experiences of clinical supervision. This was a very difficult one to do because this author here, Jones, had I think 4 or 5 papers published from the one study, and that is difficult. That kind of extraction can be difficult because you have some findings in one paper, maybe another paper has the same findings and a little bit more. So when you're doing the analysis, you kind of take all of Jones's data together rather than looking at it as 4 different papers. You have to kind of break it down and put it together again. So that is challenging, but that's just to give you that example there for that one. So what tool to use for quality appraisal? So you want to describe each study in terms of its quality. And this is another paper. Again, we have Andrew Booth. When you see his name, you know it's a really good piece of work. and they identified 102 critical appraisal tools. But going back to Cochrane endorsed using the CASP tool. So this is the tool that we use and I use, and you'll see an awful lot of papers will use the CASP tool. So the CASP tool provides questions on a study that will give you some idea of, you can say yes, no, unclear. Now, you'll notice if you go into CASP, you'll notice there are 10 questions in CASP, but this is a modified CASP that we've done in Galway, led by Catherine Houghton. Catherine actually, and Linda Beastie and Pauline Meskel. When they did some work, they reduced it to 8 instead of 10. And this is lovely. What's your overall assessment of the methodological limitations? Now, going back here to 6, this is often the most challenging one in a qualitative evidence synthesis. You're looking for evidence of the researcher maybe declaring any relationship with the participants, any knowledge of the participants, anything about their background that's relevant to the topic, anything. And often you won't see that, particularly with the older studies, but you will with more recent studies. This is becoming more important, that researchers declare their reflexivity in a qualitative paper. So next is the data synthesis, and with the QES that we would use more commonly would be that we use Thomas and Hardin's approach, and this is basically starting with reading. It's very like any qualitative analysis of a transcript. You start with the full paper, then line by line coding, and then this is very important. What counts as data? Well, data is all the verbatim accounts provided by the participants and also the researchers' interpretations, and that's important. You will find some reviewers can question you on that, and that's been my experience. But once you have a good, robust defense of why you're doing something, that's usually okay. Sometimes reviewers are curious as to including interpretations of the researcher as well, but this is what Thomas and Hardin have highlighted, and it actually you will see some papers with qualitative papers with not much data from the participants, but some very rich descriptions and interpretations from the researchers. So then you look at your codes across, and it's a back and forth process. It's not linear again. And then finally trying to find those higher order and analytical themes. And just to give you a tip, what I find works for me is I do it, I think it's done, and then I put it aside for a few weeks, and then I go back again, and then I really see, is it done? Often you have to stand away and stand back from it to see, have you really reached that higher level? And this is just an example. Now, I haven't shown you the whole page. This goes way down here. I mean, I've only chopped off the top, but this was a QES on women's adherence to endocrine therapy for breast cancer. So this was a line-by-line coding, and then the descriptive themes started to emerge. And finally, we came up with our three, I suppose, analytical themes. And they should give a sense of what this means. Like, we don't have an option. I find it's better to use something that really grabs the reader, and that can be really strong and draw a reader in. And this one here, the side effects are worse than the disease, and help us with information and support. And it should reflect what was in the data. I also need to mention best fit framework approach. And again, here we go. Andrew Booth wrote this wonderful paper on this, and I've only used this once, and I used it last year on a QES again with a master's student. So this is an interesting story. The student did a wonderful QES, and at the end, when the student got to the discussion, found a theory that explained it all, and said, if only I had that theory at the beginning, I would have used the theory to help frame my analysis. So after the student graduated, we went back and we looked at it all again, and we redid the analysis using the framework. So this was a study on apps for patients with diabetes type 2. So using this health information technology adaptation framework, which is here, we put together a best fit framework, and this is what we used, and it actually worked out very well. So we used the framework, but we also added in our own teams that we found as well. So it's that's why it's called the best fit, and it really did work very well for that study. Yeah, now I'll come back to that in a minute. I have another point to make. So this is the last point, the last stage. When you have your synthesis undertaken, you have your findings, you know what your findings are. Now to do an assessment on your findings, and this is a very challenging phase. And we use what's called the Great Circle approach, and this again is used by the Cochrane group, and that's why we use that when we're doing a QES in the groups that I work with. So there are 4 criteria. So looking at your overall findings. So you've already done your quality assessment of the studies themselves, and that CASP will inform this criteria, the methodological limitations. But you also need to look at your findings in terms of coherence. You know, how well grounded are your findings, and how do the primary studies contribute to that? The adequacy, the richness, the quantity of the data that supports that finding, and the relevance. So using this, which is very, you really have to get into it. That's not it's not something you can do without setting time aside. Then you make a judgment on whether the findings of your qualitative evidence synthesis are high, moderate, low, or very low. Now that's for each finding. So you make each statement. So you make a statement. This is one of the findings. These are the studies that support it, and we have high confidence, moderate confidence, low confidence, very low confidence. So it's okay. Like for that last study on the diabetes apps, we had low confidence in one of the findings because only 2 studies actually revealed that were relevant to the finding, and it was only relevant to in the States where people had to pay for aspects of healthcare, and it wasn't relevant in the UK or in Australia. So it's just to let you know, it's okay that it is not you don't have high confidence. You still include that finding, but give a verdict on your confidence. So this is just to show you how we presented. We had high confidence in this finding of that QES on healthcare professionals' views and experiences of palliative care for patients with a blood cancer. So this was our first analytical theme. Maybe we can pull another rabbit out of the hat. And so this was our first statement here, and these were our supporting quotes. And then we had the studies that contributed, and we had high confidence. Now, that was 2 years ago. That was put together. I don't do it like that anymore. It's very difficult to follow when it's published, and when you look at table upon table upon table of this. So now, when I'm writing up a QES, I put this data into the body and just do a table like this. So there's your summary. There's the summary, people living. This is from that other study I was telling you about. These are the studies that contribute to that finding, and then break down the 4 criteria on CirQual, high confidence, and the reason why. It's much easier to follow, I think. So you would list all of your statements down in the table. Now, guess what? Today I got an email at 20 to 2, just before I came in here, and there is a new software called ISOC that will actually do this for you. You put in your data and it will generate a beautiful table for you. I couldn't believe it. So here it is. And there's the link. So any of you who want to use CirQual, you register on the site, and you put in your references and your statements, you know, what is your findings when you get to CERQUAL, and this software will create the most beautiful tables for you. So wonderful. And there's help in there on CERQUAL. Now, it won't manage references or do screening or extracting data. That's not what it's for. This is only for CERQUAL. So it's amazing how this landscape is changing all the time. I didn't even know about this morning. And there you go. So I'm definitely going to be using that, you know, for the next one that I'm using. And I'm just looking through and have any notes here, anything to say. No, I think I've covered everything there. So that's it. Thank you for listening. And before I finish, I just need to acknowledge my colleagues, Dr. Catherine Houghton, Dr. Linda Beastie, and Dr. Pauline Meskel. I only know what I know from working with them and asking them questions. And I was actually met Linda Beastie this morning, and I asked her a question about, you know, purposeful sampling. And you would get emails. So Catherine is the person who sent me on that link today to that ISOC. We get emails back and forth from each other, and in the middle of the 12 o'clock at night, you could get a Twitter feed and another thing. So very lucky to have these people, you know, that I'm associated with these wonderful people. And just to let you know that Evidence Synthesis Ireland are running a series of CERQUAL workshops in March. So do go into their site, into the website and see. And it's Linda Beastie and Pauline Meskel will be facilitating with others those workshops, and well worth joining that. They are real experts. And again, I'm so lucky I've learned from them. And that's it. And thank you very much.